Alright team, listen up. The patient presents with phlegmasia, terulea dolens, enteritis, and epoxygenase. Let's get to diagnosing.
It could be a pulmonary embolism or maybe even thrombophlebitis.
I'm leaning towards deep vein thrombosis or even acute mesenteric ischemia.
I think it might be sepsis or pancreatitis. Those symptoms are quite severe.
I'm considering ischemic colitis, or maybe even acute limb ischemia.
No. You're all way off. The correct diagnosis is dextrocardia.
Dextrocardia, but that's a rare condition where the heart points towards the right side of the chest.
How could we have missed that?
It's a tricky one, for sure.
But what's the treatment, Dr. Hawkes?
We must perform rotationplasty. Yes. It's the only way to save the patient's life. Tracy, you called me into your office? What's the issue?
Hawkes, I heard you want to perform rotationplasty on a patient with suspected dextrocardia. Are you stupid?
No, I just think we need to rotate the heart to the right side of the chest. I have years of experience and know what I'm doing.
Hawkes, let's not forget your track record of being wrong in the past.
That was in the past, Tracy. It's time to move on and trust my expertise. I am right this time.
Oh no, this is not good. The patient is in critical condition.
I think rotationplasty was not the correct treatment for dextrocardia, despite Dr. Hawk's insistence.
I agree we need to figure out what the appropriate treatment should be. We need to act fast.
Come on, Randall, let's not panic. We'll find a solution. Maybe we can consider a different surgical approach for this patient.
You're right, Gary. Let's gather all the necessary information and consult with other specialists. We have to make the right decision for the patient's well-being.
Other specialists? Are you assholes stupid? Can't believe you almost killed a patient with your incompetence. Dextrocardia my ass, rotationplasty my ass. Are you all even real doctors?
Hawks, don't be jealous if we think other doctors besides. You might be able to tell the difference between their ass and a hole in the ground. What do you think the actual diagnosis is then?
Yeah, we need to know so we can make it right.
Tell us, Hawks. We need to fix this.
Please just let us know how to proceed.
You're all a bunch of morons. Fine, the real diagnosis is vascular necrosis. But don't expect me to trust you fools to treat it. I'll take over from here. And if any of you even think about touching a patient without my approval again, I'll have your medical licenses revoked. Useless bunch of... So, how are things going in the oncology department, Johnson?
Pretty good, actually. Some promising results with a few new treatment plans we've been trying out.
That's great to hear. I've been preoccupied with this puzzling case lately, though. It's been consuming my thoughts.
Oh, really? What's been troubling you?
I think I just had a breakthrough. It all makes sense now. I have to go check on something. Sorry to cut lunch short, Johnson.
Wait, you're leaving, but we just sat down.
I'll catch up with you later. I need to follow up on this. See you. Sorry I'm late, but we have a situation here. Patient in room 3 needs my immediate attention.
Hawks, what are you doing? You need to suit up. You can't just barge in like that.
This is unacceptable. You're putting yourself and the patient at risk. Put on the protective gear now.
Calm down, great value, Dr. Kelly. Listen, dextrocardia was a misdiagnosis. I figured it out during lunch with Dr. Johnson. It's incubation period.
What's the prognosis for incubation period then, Hawks?
Incubation period is not fatal if treated promptly. I've already started the necessary treatment.
We can't just take your word for it, Hawkes. We need to confirm this diagnosis before proceeding.
I understand your concern, but trust me on this one. We don't have time to waste. Tracy, I have to hand it to you. You were right about the diagnosis. It wasn't dextrocardia, it was the incubation period, like you said.
Well done, Hawkes. It's all about getting to the bottom of things for the sake of our patients.
If I didn't have such idiotic doctors on my team, we wouldn't have had this mix-up in the first place.
Wait a minute, Hawkes. You're the one who initially declared the wrong diagnosis. You can't blame your team for your mistake.
My team should have caught the error before it got this far. It's their responsibility as well.
No, Hawkes. It's your responsibility to lead your team and ensure the accuracy of your diagnoses. Own up to your mistakes.
Stands up abruptly. I don't need this. I have patients to tend to. Exits Tracy's office.